Welcome to ZANE Radio, video and audio updates from ZANE's friends and partners on the ground in Zimbabwe. My name is John Haynes. In this episode, Mary, who we last heard from in April, tells us about the impact that COVID is having on pensioners in Zimbabwe and the difference that ZANE supporters are making.
Good morning from Zimbabwe. In my last message back in April, the Zimbabwean government had imposed strict lockdown measures to curb the spread of the Covid-19 pandemic. At the time, health authorities were predicting devastating consequences for Zimbabwe's 14 million people. 6 months later, we seem to have escaped the brunt of this pandemic and have emerged with only 7,850 infections and 228 deaths. It is early days and we are not sure if these figures are correct. Nonetheless, it is a far cry from the numbers predicted. What started out as a health crisis in Zimbabwe rapidly became a political and economic nightmare. Opposition parties and pro-democracy activists began criticizing the government for using lockdown measures as a political tool to control the population. When tensions began to rise, the government responded by banning all public demonstrations and arresting several journalists and opposition party members. As the political drama unfolded, our teams first focused on implementing and maintaining safety measures for staff members and the elderly people that we support. Strict protocols were put in place, and we are pleased to say that to date, very few of our pensioners have contracted the virus. Sadly, some people have passed on from natural causes during this time. However, the vast majority of our elderly folk have been kept safe. This has been a difficult and challenging time for everyone. Many elderly people have not understood the need for isolation from friends and family, and some have become anxious and depressed as a result. During this time, our team members have played a crucial role in the lives of many elderly folk who live alone. Not only have we made weekly visits to provide emotional support, but we have also provided critical services and essential supplies such as food and medicines. For some, the field workers from our organisation were their only visitors during this time. One elderly person is reported to have said, "I washed my hair today as I knew you were coming." Another apologised for not wearing shoes, but said her socks were full of holes and her shoes were beyond repair. Nursing homes in this country should be applauded for acting swiftly to keep their residents and staff safe. Early lockdown measures ensured that the rate of infection in these homes has been kept low. In May this year, we partnered with the British Embassy in Harare to provide all the nursing homes with personal protective equipment and sanitizing materials. The Embassy also provided financial support for costs relating to carers and staff who had chosen to live in rather than to travel to work on the very limited public transport service. This assistance from the British Embassy, together with their clear protective guidelines, has gone a long way to help those who are most in need. There is a crisis in Zimbabwe. It started a long time ago and it has become a lot worse with the arrival of COVID-19. Informal traders and small-scale farmers have been deeply affected by travel restrictions under lockdown. Many people have lost their livelihoods. Food insecurity has risen and poverty is more widespread than ever before. For our team, facing new challenges and finding solutions is the nature of our work. For now, we will continue in our duty to ensure the safety and the welfare of our pensioners, and we will be forever grateful that Zimbabweans managed to escape the full brunt of this pandemic. Thank you.
Thank you for listening to ZANE Radio. Please donate to ZANE at www.zane.uk.com. Music was by Kevin MacLeod at www.incompetech.filmmusic.io.